Hello, my name's Andrew Bayliss and I'm a consultant with EMRS and with Basics Scotland. We're going to talk about the provision of analgesia. We will discuss some of the drugs you will use, like paracetamol, morphine, Entonox and Penthrox. We'll also discuss drugs you will likely encounter during your work, such as ketamine and fentanyl. Before we get into the specifics of various drugs, we will first discuss the principles of analgesia and then revisit the World Health Organization analgesic ladder. Pain is a highly unpleasant physical sensation caused by illness or injury. The classical textbook definition is an unpleasant sensory and emotional experience associated with actual or perceived tissue damage or described in terms of such damage. Alternatively, pain is what a patient says it is. Analgesia is medication that acts to relieve pain. The World Health Organization analgesic ladder provides guidance on introducing painkillers in a methodical and stepwise approach. It is widely applied to chronic pain and cancer pain patients, but is equally relevant to acute situations such as trauma, with the caveat that it may be necessary to start at the top of the ladder. Analgesia can be administered via a number of routes. The choice will depend on the patient, the situation, and the drug being used. We have the options of oral, intramuscular, intravenous, including intraosseous, inhalational, buccal, intranasal, and topical. Of course, it's important to remember the basics: clear communication and a comforting manner, avoiding unnecessary movement, splinting of injured limbs, appropriate dressings, covering burns with cling film. Always document what you have given and why, and if there are any unwanted effects. You can always give more, but you can't take it back. Consider alternatives rather than pushing on with one drug that isn't working if no real benefit is seen with a reasonable dose. We will discuss analgesia more during the face-to-face element of the course. We'll start with paracetamol. Paracetamol is a good drug, especially since the introduction of the IV preparation. It is a mild painkiller on its own, but also potentiates the effects of opioids when administered concomitantly. Non-steroidal anti-inflammatory drugs, often referred to as NSAIDs, such as Brufen, are another group of drugs which can be administered alongside the opioid and non-opioid medications. There are a few restrictions to their use, and so are less often used in the pre-hospital environment, although more common in pediatric use. Entonox is an inhalation analgesic, being a combination of oxygen and nitrous oxide, or laughing gas. It requires a degree of cooperation from the patient to administer. Side effects include dizziness and feeling lightheaded. Its onset is quick, and it is short-acting with good safety margins. Should be avoided where pneumothorax is suspected. Another inhaled analgesic is Penthrox. This is actually an anesthetic vapor, but at the low doses used pre-hospitally, its analgesic properties are the dominant effect. There is an associated checklist to ensure it is appropriate to administer due to some of its side effects. Again, patient compliance is necessary for administration. Buprenorphine is a moderate-strength opioid that has somewhat gone out of favour for acute use due to its unusual properties, but you may still encounter patients who take it for chronic pain. It is a partial agonist, which may hamper attempts to use other opioids to provide adequate analgesia. Morphine is a cheap and effective opioid analgesic. Its onset when given IV is relatively quick, a few minutes, and it has a decent duration of action. It carries the risk of sedation and respiratory depression with increasing doses, and so should be titrated up to effect with a degree of care. An antiemetic such as ondansetron should be considered because nausea is a common side effect. Fentanyl is a potent, quick-acting opiate which you may encounter. It can be administered via the IV route, buccal, such as lozenges, and topical routes, such as in patches. Due to its potency, respiratory and sedative side effects can be quite marked, so care is required in its use. Diamorphine is another opioid with a potency slightly greater than that of morphine. It has the advantage of being able to be administered intranasally. For this reason, it is often encountered in pediatric practice. Ketamine is a non-opioid analgesic. It produces a dissociative state, thus disconnecting the patient with reality and their pain. It is an analgesic at low doses, a sedative at medium doses, and an anesthetic at higher doses. Careful judgment is required in its use, and so should only really be used by people trained to deal with the potential complications.